All right. Thank you so much for coming back, MYB Community. Champ Ron, the Minding Your Business podcast. We are here, episode number 148, Entrepreneurship, Real Estate, Trending News. There's no business like minding your own. Recording this on Friday, kind of early afternoon here, May the 1st. So we've made it to May 1st, which means that many of us have been quarantined now for 7 weeks. Woo! You've been enjoying your time at home. Hopefully you have. Or maybe it's revealed that you don't enjoy much of your time at home, depending on your situation. But either way, hope, again, that you're remaining safe, and just know that, again, we will get through this, and there's going to be life on the other side of this. And how you prepare for that is now, by doing everything that you need to do, whether you're in the workforce and or you're in business, making sure that you do what you need to do to be prepared. And that you're looking at opportunities and looking at how you're engaging with your current clients as well as your prospects. And so thank you so much. Make sure you subscribe to the show. 5-star on Apple is great. That allows us to continue to reach more great people like yourself and continue to expand the show. TheMYBpodcast.com is where you can go to learn more about the Minding Your Business community, as well as listen to previous episodes and schedule yourself if you're interested in being a guest on the show. We would love to have you and showcase your brand, your company, or your upcoming event. All right. Listen, I'm excited about today's guest. He's joining me, extremely busy, but he's taking time out to join us here on the Minding Your Business podcast. It's Steve Watson, who's the CFO of Trendbreakers. That's trendbreakers.com, where you can go and you can learn more about the company and how you can get involved. But employee benefits obviously is a big topic today, as many of you know, that have been impacted in whatever way, whether you're working from home now for the first time, remotely and virtually, or unfortunately you've been furloughed or laid off or fired. Whatever your situation is, employee benefits obviously is near and dear to all our hearts and our minds as owners or in the workforce. And so, Steve, thank you so much for joining me today.
Super excited to be here. Thanks for having me on.
Yeah, absolutely. Love your background there. Looks very homey. And
yeah, we're all using these virtual backgrounds, and so nobody knows where we are. I'm actually live from my truck in a parking lot right now in Arizona because I have so many kids running around the house that this is the only quiet spot I can look. So this is my Zen looking background. But
yep. And as great as this studio looks behind me, it actually is virtual as well. I'm here in my bonus room in my house here in Memphis, Tennessee. Yeah. And so, yeah, it is what it is. It's the times of 2020 for sure. So, Steve, let's jump right into it, man. Tell us about Steve Watson, how you got into business, kind of how you got your start.
So my background's in finance. I'm one of those number geeks that just love spreadsheets, and so I've worked my way through getting an MBA in finance, up the career ladder in finance, got my CPA, ended up being a CFO of about a 500 employee company here in Arizona. And along the way, I've actually, about 10 years ago, the HR director quit. And so they looked at me and they said, HR, finance, that's about the same thing. We'll give it to you. And I'm like, I don't know in what world those two hats are the same thing. But I took on that role. And I'm somebody, if you give me an area, I'm going to dive in as much as I can. So I got certified in HR. I've spent 10 years overseeing HR. I go to all the national HR conferences as well. And so I have this kind of unique background between HR and finance, and where those things overlap the most is employee benefits.
Yeah.
Because it's the financial part of like being able to pay for those benefits, but also being able to recruit and retain employees, the HR side of those things. And so I've just started learning a lot about that area, and I kind of got shocked into it 10 years ago because I had a 30% rate increase. And so that turned out to be hundreds of thousands of dollars for our company, hundreds of dollars for each employee. And I was the one responsible to negotiate that. And I was just kind of shocked because after all this schooling I'd done, after all this experience I'd had, nobody ever taught me how to negotiate a $3 million contract on health benefits. Nobody taught me the levers of what makes it go up, what makes it go down, what I could do about it. And so I've spent the last 10 years kind of figuring that out, was able to save about $500,000 a year from my company. And then just recently I launched Trendbreakers, which is a community of employers. So I don't sell insurance. I'm just an employer that I'm just sharing with other employers what I did to help others replicate that, and then I can learn from them as well. So that's what Trendbreakers is. So it's a community of employers like me that buy benefits for their employees. We share ideas and have speakers and do stuff. And I'm super excited about what I've been able to learn, what I'm learning from everybody else. We have about 300 employers right now in the group across the country, and
Yeah.
I'll be growing by about 5 to 10 every week right now.
Yeah, absolutely. And so, how are these employers finding you? Or is it from your network and just, and your team prospecting, or are they finding you online, or how are they
So I'm
getting
very
to
active on LinkedIn. So a lot of people find me through LinkedIn and post there. I used to do a lot of speaking events, but now under COVID-19, we're all sitting at home. But
Right.
I got asked to speak at the National SHRM conference, which is the big HR conference there, and so they'll hear me speak there. People refer their friends in there, and then I send out invites to other employers that are like me, and just invite them into the group. And
Yeah, excellent. And so, as you're helping them negotiate rates, what goes into negotiating rates? You talked about learning that, Steve, over time. What goes into that, that you can share in terms of the strategy for negotiating, employee benefits? Because, a lot of people that may be listening to this podcast, or, we may not be fully aware of what goes into that. We just look at, oh, well, this is what we get. This is the copay. This is the, the what do you call it?
Deductibles and
yeah. I mean, this is what my out of pocket is, I guess,
right.
and comparing that. But what goes into that negotiation?
So some of the components is as employers, we usually don't deal directly with the carriers. So we have a broker. So we'll negotiate with that broker. And so the first thing that employers need to evaluate is that broker really on your side of the table, or are they a sales rep for the carriers? And a lot of it has to come down to, and a lot of people don't know this, but brokers, most of them get paid commissions.
Sure.
Most of those commissions are based off the top of the premiums. And so if you think back to my scenario where I took a 30% rate increase, guess what that broker was getting? A raise.
A raise, right.
So I'm taking a hit, and this broker who's supposed to be on my side helping me lower everything is getting a 30% increase. And I don't know about you, but that just really bugged me. I'm like, yeah. Why should they get, they're not doing any more work just because I use the insurance. Why are they getting a 30% raise? And so that's the first thing that I changed. I said, we're not doing this anymore. If you have more than 50 employees, especially have more than 100 employees, you have the control as an employer to set that relationship. And so you can set it the rates, you can set it to fee based, you can do whatever you want. And a lot of employers don't know that. They just assume that it's just all baked in there. They assume that the carriers. And why that's important, it's not so much the amount of money that they're making. It's like, are your incentives aligned? Is the person you're using to help you, are they getting paid more when your rates go up or less when your rates go up? And you want them to be on your side of the table.
Right.
And so that's one of the first things I changed. It's one of the first things I recommend all employers do is pull them onto your side of the table. That's just one little piece. I mean, they get paid bonuses, they get paid overrides, they get paid like all these other things. And each one of those things the carriers do because they know that it influences the brokers and what they present to employers.
Right. Yeah, absolutely. And like a lot of things in business, it comes down to the motivation and understanding the motivation for yourself, and then obviously for the broker on the other side. And so, does your company work within all the major insurance carriers? And
yep.
Kind of in that brokerage sense, you're able to help, say the 300 or so businesses that are currently in your portfolio on your team. You're able to help them depending on who they're working with existing, and maybe there's a better.
Yeah, so they don't have to replace their brokers. I'm not a broker, so I'm not trying to replace their broker in any way. But a lot of people don't know how to evaluate their brokers. And so one of the first things I do, and you can find on trendbreakers.com, is a broker scorecard. So you can go in there, you can download it, you can kind of rate your own broker on how they're doing towards transparency, how they're doing towards, accountability and different things. So some of the ways that I evaluate my broker, because I use a broker, I've been using a broker for a long time. So the recommendations I give to other employers. Again, that's one component. I would say the second thing I recommend employers do is break down the components. And so while there's, this big insurance things, there's a lot of things wrapped into that. So for example, like when we think about insurance, like what is it more important to? Like, okay, well, we want access to a doctor. Like we want to be able to go there and meet with a doctor. We want access to pharmacy, to prescriptions. We want to have some type of like financial insurance if we get cancer, that it's going to kick in and we're not going to go bankrupt because of that, right? So those are kind of three major components in there.
Yeah.
So ways that employers can also save money is try and break down those individual components. And I'll just give you a little story right here. So have you heard of GoodRx?
No, I haven't.
So that's first thing you're going to do today when we're done with this call is you're going to download this app. So the app is GoodRx. It's
GoodRx.
free. You don't have to put any personal information in there. You just download the app. What it does, and I'm going to tell you the story, and this is why it's important. So last year I had allergies in my eyes. I got really red. I talked to my doctor. He says you need these allergy drops. And so
Right.
I run over to the pharmacy. The pharmacist looks at me and says, "Oh, these are kind of expensive." I'm like, that's not a good sign. I'm like, "Well, how much is it?" And he says, "It's $235." And I'm like, "Whoa, man, my eyes are red, but maybe not that red." I'm gonna start walking out. But that's when we all pull out our insurance cards, right? We're like, "Okay, whoa, I got insurance, so I should be fine." So I pull out my insurance card, and he says, "Well, it's $231." I'm like,
Wow.
"Really?" I'm like, "Come on, Blue Cross, you got me $4 off of this stuff. Good job, insurance company." So again, I'm about ready to walk out, but then I remembered that I had this app on my phone. So I don't represent GoodRx. I have no connection with them, but I pull up the app, GoodRx, using this at the same pharmacist, using the same prescription, same doses, everything's exactly the same. It's $75 showing them the GoodRx kind of coupon thing versus $231 using Blue Cross and Blue Shield. But what's really nice about it, then it shows you within your geographical area that if I drove 3 miles to the local grocery store, it was $20. So again, now I've dropped from $235 all the way down to $20.
It's a big jump.
And that's one transaction for one person throughout all the year. So it's a different way to get pharmacy benefits. And so it's something you can do individually, but it's also something I tell employers about. Again, if you translate that across 400 employees, all their families, over all the transactions they do the whole year, how many hundreds of thousands of dollars could you save by trying to do this in a different way?
Yeah.
And the reason a lot of employers don't know about this is because no broker gets paid that off GoodRx. There's no incentive. And so if you're just trusting your brokers giving you all of the options there, we have to remember that sometimes what they're giving us is what's good for them and not so much maybe what's good for us. And so we have to do some due diligence on our side, both personally as well as employers, on being able to find the right options for us.
Yeah.
And that's just one example. Pharmacy, you can do the same thing about doctor's offices, about hospital stays, about buying insurance and stuff, but there's just so many, it's so ripe with opportunities to save money. It's just crazy.
Wow. And that is crazy, man, to go from 235 down to 20.
Yeah, I promise you will save a lot of money personally with that app. And again, that's just one. There's other apps out there and different things, but it's just we have this myth that's just ingrained into us that insurance has their best price, that we don't even think about it even more.
Right.
And just to break that a little bit more, there was a guy that I knew that went he was going to do a surgery, and he goes on the website of the surgeon and everything. They had it listed. The cash price was like $10,000 for this procedure he had to do. He talks to his employer, says, "Look, it's $10,000. I know," and he was really good. Like most people wouldn't even say that to their employers. They would just go do it. But he told the employer, goes and does the surgery. And when the employer got the bill from the insurance company, it was $40,000. And they're like, what's with that? It's $10,000 cash price, $40,000 insurance. So they call up the doctor and say, "Well, what gives us?" "Well, that's the rate that the insurance company negotiated with us." Wow. And you're like, just why? Why does that happen? Again, I know that we don't have all day to sit here and talk, but there's reasons why that happens. There's reasons why, you just start following the money and seeing where do insurance companies make money. And anyways, we can go a lot of different routes, but yes, you just need to shake your head. Yes, it's really messed up. The system is crappy not for everybody, because there's a whole bunch of people making a ton of money off of this. If you look at insurance carriers, stock prices and different things, it's way up right now. But as a society, as employers and stuff, I'm done. It's time for us to kind of step up, share ideas, do things better. Cause I'm done with the way it's set up.
Yeah, no doubt about it. That's crazy, Steve.
Yeah.
So today, in today's environment, that's unprecedented with COVID-19 and social distancing and quarantining. What are your thoughts on employee benefits today? It's been, a lot of people have been impacted. And so what are you and your group?
What's your initial thoughts? What would you think? So if you thought that you were going to renegotiate, what would you think? Do you think they're going to go up, they're going to go down, stay the same? What would you think?
I guess my thought would be that they would go up. You would see some kind of increase, because you've got, I would imagine there's this increase of people on Cobra, right? Or on, some sort of.
And we'll just stay there. So yes. So I mean, I think everybody's assuming, I've heard people say it's going to go up 20%, up 30%. If you think of insurance, we're basically just we're prepaying our medical costs for next year. It's just a prepaid plan, basically. And so when there's uncertainty, insurance carriers are going to want to put cushion in there, right? Because they're like, look, I don't know what it's going to be like next year. I'm just going to load it up there and do it. The reality is, and this is where it gets important, is right now claims are extremely down because nobody's doing back surgeries, nobody's doing knee surgeries,
Right.
nobody's doing eye surgeries. No, like the whole month of March, now the whole month of April. So as an employer, you've been paying, maybe you're paying $100,000 a month for your insurance claim policies. The claims are really low, like nobody's using it right now. And so the
Right.
insurance companies are making a killing off of this right now. And so again, now there's this pent up demand coming.
Sure.
There's these surgeries that will happen later.
And that's kind of what I was thinking is,
And nobody's quite sure. I've seen studies that while yes, there will be things happening, also will they have the capacity to do all those surgeries, or will they just kind of spread them out? Some people end up just not having them. Some of them are elective; they just won't end up doing them. They'll figure out other ways to take care of it. What I'm worried about employers right now is, one, if you're on a prepaid plan right now, you're kind of getting hosed because they're keeping the money. If the insurance companies just add in a whole bunch of rate increases because of just cushion and thinking about what's coming next year, and if those things don't pan out, then they win again next year, right?
right.
Now, what's different about COVID-19 is just it's not that expensive to treat. There's no $1 million drug yet, to treat it. There's no surgeries you have to do with it. The body, we just kind of let the body do it. And for those extreme cases, they end up in ICU, but really they're just laying in bed. We kind of take care of them and do stuff, but it's just a very small portion of people that end up in those things. So from an expense, and again, a terrible disease, for those that are suffering from it, heart goes out to them. From a pure financial standpoint, it's not that expensive. It's not that worrisome. I mean, I think the highest ones are like $30,000, surgeries. That one I just told you about, that one surgery ended up being $40,000. Other people do $80,000 surgeries. I mean, those bigger things are happening all the time.
Yeah.
So the point being is, if you're an employer right now and having to negotiate benefits because maybe your renewal is coming up right now, or personally, you need to push back. You need to push back against that cushion. You need to push back against carriers. And it's a time that instead of going, and the insurance companies use different terminology. They call them self-funded plans or full insured plans, all these other things there. I call them basically prepaid plans versus pay-as-you-go plans.
Yeah.
It's a wonderful time to switch over to pay-as-you-go plans.
Mm.
And so you build in like caps and different things in there, and we get all the technical side of it. You build them in there so you protect yourself, but then you get to keep the savings. And it's a way to keep the insurance companies out of like building these cushions in there.
Yeah, no doubt about it. Steve Watson, today, our guest, CFO with Trendbreakers. Trendbreakers.com is where you should go. I'm definitely going to check out GoodRx. I love.
Oh, you definitely should. I mean, and you should share with other people. It's an amazing thing.
Yep, no doubt about it. Steve, let me ask you this. What about, for the individual? So for the individual right now today, what can they expect going forward coming out of, COVID-19 and, I guess there's no wiggle room, I guess, for the employee to negotiate, but.
Yeah, so if you're an employee, you basically don't get a say in it, right? Your employer negotiates on your behalf, and the only way you choose is you choose to work there, or you choose to work other places.
Yeah.
If you're an individual, let's say you're a small business owner, you're a consultant, you lost your job or different things, you brought up COBRA. What COBRA is basically it's taking that company's insurance policy and then allowing you to keep buying that insurance policy for up to 18 months. The reason it gets expensive is, let's say that insurance policy is $1,000 a month. Usually the employer is paying $900 of that, and you're only paying $100 a month of it. The employers pay a huge chunk of everybody's insurance.
Right.
When we leave a company, the cost of insurance doesn't go up. It's still $1,000. It's just us as individuals are now having to pay the full amount, and so we're all shocked. But that's always been that cost of that policy. Does that make sense?
Yeah.
And so you have a choice to do it. Now, one little tip is that you don't have to elect COBRA the very first week that you leave a company. You have up to, I think, 2 months to do it.
Right.
And so some people will just wait until the end of the 2 months. They'll see if they'll find another job. They'll do things. And you can always, if you start having some big health concerns, you can backdate that things. And so there is a little bit of wiggle room in those first 30 to 60 days.
Yeah.
The other option is again, start thinking about the components. I need pharmacy plan. Okay, well, let's go find GoodRx. That'll give me, prices at a, pharmacy options at a lower price. I need a doctor's office. There are many doctors that are creating a new model, which is actually not a new model. It's how it used to always happen, where you pay directly to the doctor. They're called direct primary care doctors. And instead of you paying them per visit, you just pay a monthly fee. And so maybe it's $70 a month. And then you get all access to them. You can go as many times as you want. You can text them. You can call them. You can say, do I need to go in? Do I not go in? They get many different tests and different things at cost. And so it's a way that you almost have this little mini insurance plan. Like they become your hospital kind of system. Your doctors, they're able to advise you. You get the good RX. And then the last thing, there's cost sharing plans. Like Sedera's one of them. Some religious groups have different ones. But basically, you pay the first $500 or $1,000, and then the insurance, you share things above that. So you definitely need something like that in case you get cancer. Like you want to have something in there.
Right.
And then as an individual, you just pick. But if you put those three components together, they're going to be much cheaper than Cobra. And most of the time, you may be able to get better coverage because now you have a doctor you can call anytime. You get pharmacy cheaper. You have some type of insurance policy in there. And so that's what I see individuals doing.
Yeah. Absolutely. And then what do you guys see individuals doing in terms of that selection process on the front end? So walk me through, if I'm new to a company and I've got to select my benefit package. Of course, you've got individuals, you've got for families, you got usually the individual plus one, those sort of options. What do you see? Is there any trends with that, currently right now, or is it just kind of how it always is with the individuals selecting, I guess, the package based on their, health, lifestyle?
Usually companies, no, it's gone through phases. So we had this HMO phase back in the 90s where it was like a very limited network that you would go to. Yeah. People weren't very excited about that. And so they wanted a PPO network, which basically means, broader network. You can go wherever you want. You don't have to have a doctor, have a referral. You can go there. And that's what's been going on. But those are expensive, right? Because in order to get those doctor offices into the network, the insurance carrier has to negotiate with that doctor, and they can basically set the rates that they want. And so hospitals and stuff, it's more expensive, it's broader. And then probably 10 years ago, there was a big push for HSA plans.
Yes.
So HSA is where the individual would pay more up front, and then this deductible would kick in, and they call them consumer type plans. I would say those plans are starting to max out. People aren't using them as much, or they're not as popular, mostly because they said, okay, we're going to give the employees the ability to choose, and if they save money, they get to keep it. The problem is there's still not transparency in pricing. And so as an individual, if I show up at the hospital, I sign my life away, I have no idea how much that costs. Yeah. Right. It's only after it all comes out at the back end. And so it didn't drive costs as much as they thought it would. But I would just say for individuals, just remember, companies usually offer one plan. They have a United Healthcare plan. They have a United or a Blue Cross plan. They're just different ways to finance it. I mean, so there's PPO way to finance. There's an HSA way to finance. It's a way to pay for it. And really, it's like, would you rather have more come out of your paycheck and then less at the doctor when you pay copays and deductibles, or would you rather have less come out of your paycheck and more come out when you go to the doctor? So just after doing the math, I'm a math geek. I love doing it. I've looked at usually just the answer at the end is if you're really healthy, HSA plans will always win out because you get to keep the money. If you're really sick and you blow through it, usually HSA plans will win out as well because their out-of-pocket maximums are usually lower than PPO plans. And then in the middle, it kind of depends, but it's usually not that big of a difference. It's just more of just how, again, would you rather have more out of your paycheck or more when you go to the doctor, and they can kind of even out. But
yeah, that personal economic, I guess the thought that everybody has to give, for themselves in their own household for sure. And so,
and a way to save money is like make sure that if your spouse is working another employer, make sure your spouse signs up for that employer's plan because the employer will pick up a big chunk of that cost. Also be looking for government type of programs. When Obamacare came out, different things, a lot of people would qualify for Medicaid. They just don't realize it. I mean, they raised up, there's the poverty level, and then it was up to 130 or 150% of the poverty level. And then for kids, it's almost up to 400% of the poverty level. Yeah. And so I had a friend of mine that he had a good kind of accounting job, was making $60,000. He qualified for the government's kids care program. He had 4 or 5 kids at the time. Yeah. But because the size of his family, he ended up getting all of his insurance for his kids for like $15 a month, and there was no copays and no anything. And then he just signed up as parents.
Wow.
Now, some of that you have to find out yourself. Again, there's no broker that's going to tell you that stuff because they don't get paid for it. The employer is not going to really tell you about it because they don't.
There's no benefit to them. There's no
Well, no benefit, and it's just kind of weird to say, well, you can find it out cheaper at other place than, because you use the benefits to recruit people, right? Not be like, well, but as individuals, I mean, just always kind of go out and ask other people and listen to things. That's why I love Trendbreakers, is because you have 300 different kind of situations, and everybody just kind of throws out what they think and ways to save money, and I learn a ton from it. So.
Yeah, absolutely. And so, Steve, how many, not so much how many, but yeah, what size companies are able to get involved with Trendbreakers? Is it down to, a guy or girl that's got a, 5 or 10 person shop, or is it?
Yeah, really, really good question. I would say that under 50, things are tough.
Sure.
You more because you're having to build your own type of plans. Now, anybody's invited to go there. Actually, not anybody. I don't let brokers into that group. I don't let carriers into that group. I want it to be employers there. It doesn't matter if you have 10 people, you have 10,000 people. Like, I want people in there to be able to share ideas.
Sure.
The solutions and the strategies that you're able to do are different if you have less than 50. I'd say it kind of segments. So less than 50 is one strategy, 50 to like 125 is another strategy. And if you have more than 125, it opens up the world to all these amazing ability to save money. So
Sure. Yep, absolutely. No, that definitely makes sense. And so what would you recommend, for the person that's, owns a shop or a business that's under 50 employees? Let's just say they want to offer, employee benefits, Steve, but they've got, say 7 employees. What would you recommend for them? Is it, or what would be most cost effective, for those folks?
I would start building it. So, and build the components for them. And so I would show them about GoodRx. I would give them the cards. I would say, here's a way to like save money on it, and there's no cost to it. I would probably start looking at direct primary care offices in your area and just sign up, and maybe you pay for that as an employer and say, look, I'll give you up to $100 a month to find a doctor, and you'll have coverage for that. And then I would look into Sedera, which is a cost sharing plan and you decide as a company how much you pay for it or not. And you put those 3 together and you basically have an insurance plan. Yeah. Now, it's not going to be a Blue Cross plan like the name of it, but you're going to have all the components of that plan, and it'll look, feel, and it'll get to keep your employees happy on that plan.
Yeah, absolutely. No, that's good advice, and really sound, I think, practice for people to consider. So what's next for your company, Steve? We talked about, how insurance is priced for, today for tomorrow, or a year out. So what do you see as next? And do you guys get involved in other benefits? You see, these tech companies now and kind of the fintechs where they've got a, right, a foosball table and a, daycare, right, on site, and, all these, things that are somewhat out of the box from the, traditional company sense. So, what do you see as kind of on the horizon for your company? And do you see these other kind of fringe benefits, continue to expand, here over time?
Again, a really good question. I think the fringe benefits just took a big hit with COVID-19.
Wow.
And so because unemployment was so low and it was so hard to recruit new people that you had to like add in all these little perks to try and get them to come over to your place. But now with, I don't know, it's like 1 out of 6 people are out of a job right now. I mean, people just want a job. Like, it doesn't matter. Like, if I get medical insurance and a job, like, I'm good. And so it'll come back, as the economy comes back and different things. But I would say for the next, I don't know, I'm just guessing, probably the next 6 months to 2 years, there's probably going to be, I don't think those fringe benefits are going to have the impact that they had in the past.
Yeah.
I think for at least the stuff that I do, I'm excited about coming out of this kind of COVID-19 things, because I think it'll spark a lot of people wanting to learn more about this, of kind of being open to learn about ways to do different things and trying out different things. Because when everything's going well, it's fine. Average cost for benefits is $20,000 a year. It is what it is. Business is going well. I don't know to really worry about it. And I'll say, look, I can help you get it for half. Well, it's just a small thing. But now, right, I'm excited with the interest that people have and the ability to share.
Yeah, No doubt about it. Steve, got a quick question from our Facebook Live audience I want to read
Yeah.
to you and get your thoughts on. This is from Lakeisha Williams. Thank you so much, Lakeisha, great friend of the show and great, actually, healthcare professional herself and her husband doing great things in the community. She asked, how can I negotiate double coverage? My husband and I both work for major companies, but we couldn't cover each other on the health insurance. Once my husband's health insurance company found out that I was covered at my job, they dropped me. So what are your thoughts on that in terms of double coverage for, particularly for spouses? You got working spouses, Steve, each of their jobs offer.
Yeah, I guess the question would be is like,
Insurance.
why would you want to have double coverage? And so if, let's say, the husband has coverage at their company and the wife has coverage at their company, usually you'll end up getting the best bang for your buck by using that individual to use their company's things, because the company's going to pick up 50% or 80% of it or some chunk of it, right?
Right.
Where it gets interesting is when you start having, and this is coming from the company standpoint, maybe one company has a lower deductible, or maybe they have a lower copay or lower out-of-pocket stuff. And so for somebody that knows that they're going to have some big expenses coming up, they're going to do the math in their head and say, well, it's not worth it. I mean, I know my company pays a little bit of my premium, but I want a lower out-of-pocket maximum, so I want to go on that other company's one. The reason companies don't like that and why they kick spouses off of it is it creates a huge liability for them.
Hmm.
And so they have their employee working there, but they bring the spouse on that may bring in $100,000 cost or maybe a $300,000 cost. It's an extra, does that make sense? It's an extra
Yeah.
risk liability that they're not going to get extra production out of and stuff. And so they'll, and this probably started 20 years ago and it's getting bigger and bigger where companies say, look, if you have a working spouse, they have to go work, they have to get insurance from their other company. So
Yeah.
there's not a lot you can do. I mean, to answer that question, they can set their own policies. They can say where you are.
Is
It
that
kind of
something
is what
that,
it is.
Steve, where like an Aflac would come into play, where you would, get one and then kind of, have more of the supplemental insurance to kind of.
Yeah, I mean, so Aflac will usually kick in to like help pay the deductibles, and if you hit the hospital, that they'll have an indemnity pay to pay you like $1,000 if you go to the hospital. Again, if you do the math, I'm not a big fan of those type of plans because
Yeah.
they get to be expensive. And if you would just kind of self-insure, which basically means if you just set that money aside every month instead of giving it to Aflac, you'd have more than $1,000 after. I think the cutoff was like over a year and a half.
Right.
Um, Doing it. But it's hard because I think that we see our spouses and they're working there and their spouse, they have a great plan over there. We want to be on there, and it just gets annoying that they kick us off. But
Right.
sometimes understanding from the employer perspective helps. But I don't know if that helped Lakeisha in her question. But
Yeah. Yeah. So, Lakeisha, let us know in the comments if that answers your question, or if you have a follow up or anything like that. We
yeah,
definitely appreciate that. And so, for yourself, Steve, where do you see you kind of growing with, your company? Obviously, you've got this unique kind of interesting background between finance and healthcare HR. Do you see your company continue to grow and expand? Obviously, you're going to add more companies within your group and things like that. And where do you see yourself kind of fitting within this self?
yeah, I see. Again, I want that group to get as big as it can, because the more
Sure.
people in there, the more help. We talked about this before the show started. I plan on adding a podcast so people can come on and ask questions, and
Yes.
if they want to get really into this type of area, be able to talk about it. What I'm really kind of what's driving me right now is there's no education for new HR representatives, new CFOs into this world. So you just start working in a company, you're just supposed to know this. And
Right.
if you don't know it, I mean, you have a broker there, but you don't really know how to evaluate that broker and stuff. And so I'm working on some type of training core stuff that, for anybody that's going to like come into this space, it's going to negotiate benefits, that they could, take this training or do some kind of get certified in how to negotiate these benefits is a need that I see out there. And then the
Right.
last thing is I really, like, if you're in Arizona right now, I can help you replicate everything that I did. I can help you get set up with the partners. I can get you set up with, the carriers and different things and kind of replicate what I've done. I'm trying to set that up in various states. And so I'm set up in Tennessee and Texas and Florida and Washington, just got set up in Colorado. So trying to find more people. So as employers come into the group, they want to kind of replicate at least what I've done.
Yeah.
And maybe they're in Michigan, trying to find partners in those other areas to replicate with.
Yeah, absolutely. I think a big opportunity for you would be in some of the different associations, if you aren't already, some of the healthcare associations.
Yeah, I'm the three that I'm a big part of. So I'm a big part of SHRM, which is a big HR one, and I
Sure.
just got asked to speak at their national conference, which I was super excited about until COVID-19 ruined everything and like canceled the. Or we don't know if it's gonna be
Right.
canceled, but it probably will. And then
Right.
FEI and CFO Leadership Council are two big CFO associations there. I'm a
Yeah.
part of, but yeah, I'm looking to speak at different ones. If any of your listeners or you guys know about things that you find beneficial, I'm happy to fly out to wherever and get up on the stage and kind of
Yeah.
talk, because I just think it's knowledge is power. You know,
Sure.
it's really hard to negotiate benefits if the other side just has all the knowledge and you don't know anything. And so I'm just trying to like level the
Yeah.
playing field.
Exactly. That's the exact words I was going to use. And I think the banking associations would be great for you too.
Yeah,
Steve,
I'd love
to
to.
get involved with. Yeah.
Yeah, I
So
was talking to a CFO from a big bank in Maryland. They had about 800 employees, and he's like, "Look, I've never heard this stuff. Like, how this, you know, because that money matters, like the way people get incentivized and stuff. And so as I explain all that stuff, it helps them make better decisions. And so,
yeah, one of the things I've learned in banking is that CFO to CFO talk is very valuable.
yes,
And can go a long way. And so
it
with your
can.
CFO status, talking to CFOs at these banks, you guys have your own kind of
Yeah,
fraternity or
and
sorority.
and the well, and the thing about that is like when we get into a room and we're talking to like with a vendor, we have to have this like almost persona or facade that we know what we're talking about there. And so
Right.
they might be throwing out terms and talking about self-funding and stop loss and all this stuff. And the vendor may think that we know what we're talking about, and we don't. I mean, we honestly don't. So if you are a vendor in this space, you need
Yeah.
to dumb it down, because when we're CFOs talking in our groups, I mean, that's the first thing we talk about. Like, wow, I don't really know how this works. I don't know why it keeps going up, or I don't know what to do. And we're willing to be vulnerable within our peer group,
Yeah.
that you would never see on the outside. And that's why I liked having that group closed, because then we're just able to open up and like ask real questions. And
Right.
yeah.
No doubt about it. No doubt about it. So how many employees work for you? I
So
imagine you're
that,
in a one-man shop. You've got others
yeah,
that.
so I have two things. I have my day job where I am a CFO. So there's about
Sure.
500 employees at that company.
Yeah.
And then my Trendbreakers is a company I just found. It's just me. I mean, it's just me and
Okay.
some, consultants I use for marketing and stuff. But the power of that group is not so much me. It's those 300 employers are coming together and sharing ideas and doing stuff. So
Yeah, absolutely. And Lakeisha came back and said, yeah, that did answer her question. So
okay,
thank
good.
you again, Lakeisha, and thank you, Steve, for doing that. Um, so talk about, we were talking a little bit offline, Steve, about family. And of
Yep.
course, during this COVID-19, this has brought families together, hopefully for better, but in some cases, maybe not so much. But, talk specifically about the impact of family for you for business.
Well, first off, this is where I really am. So if you're on video, so I'm in a truck right now. I'm sitting in a parking lot in Arizona, and it's
Yeah,
like 92 degrees outside right now.
yeah, I say,
Why? Is because I have 7 kids. I have, my oldest is 15, my youngest is 2. We're all quarantined together. We're having a blast, but you would not be able to hear me talking if I was sitting in
I
my
can
house
imagine.
right now. But I family's everything right now. Everything that I do is for family. And I love, we just went camping over the weekend. It was so much fun just to be outdoors with everybody. And
Yeah. Yeah, absolutely. So no, that's awesome, man. And definitely shout out to you with that large family and that sort of thing. Of course, MYB is familiar with my family, with wife and 3 girls, and we're making it through too. And we're extremely fortunate. I mean, you have a 2-year-old as your youngest. I
yeah,
couldn't
I have 6
imagine.
boys and then 2 little, a 2-year-old girl at the end. And so she's spoiled from everybody, and
Oh yeah, she's the boss.
yeah,
That's for
she
sure.
is.
Yeah, I just couldn't imagine if, what if all your kids were 2 or, 1 or 2? I just couldn't imagine in this time for people who've got like really young kids. And
Yeah, it's been different, because even the spread, I get my extroverts and my introverts. Like my 15-year-old just loves people, and he's just needs to get out and do stuff. And so,
yeah,
we've been trying to help him know about social distancing and doing stuff. And then we do the best we can. But sometimes he finds himself out at the wash and there's like 3 of them hanging out. And it's like, whatever. It's just,
right.
don't spread it.
Exactly. Exactly. Steve, as we kind of wrap up here, and you've given us some great, rich content, getting a lot of thumbs up, a lot of hearts here
That's
online. So
good.
that's incredible. Thank you guys for doing that. what are one or two best practices for you? Obviously, you're successful. You're continuing to be success. You've been through the fires, I imagine, and the tough times, and kind of gotten through those. And not to say you won't have them in the future, but you come off as a guy that knows how to tackle things head on and has the right perspective and right motivation. What are one or two best practices that you could share, with all of us that have been successful for you?
Yeah, so two things. I'd say the first one is I really live by the mantra of not letting perfection get in the way of progress. Like
Mm,
too many of us just wait around. We want everything to be perfect. We're not going to launch anything. I'm not perfect at anything. Like I'm a CFO that's trying to start a community group and get online and do so. It's just way out of my comfort zone, but it's progress. I'm going to make mistakes. I'm going to say things I shouldn't say. I'm going to come off being dry. I'm going to get too technical, but I'm going to just try it and I'm going to learn. I'm going to do better. And so I've really, same learning about benefits, learning about HR, learning about anything, just move forward. And I think all of us right now are trying to do that with COVID-19, just trying to like do the best we can and just be okay with mistakes. And the other one I would say, and I think if I could go back to myself, 10 or 20 years ago and kind of slap myself across the face, and it, it, it would be networking. And so networking from just finding a peer group. And so as a CFO, a lot of us just are in our own little bubbles. We're just working with our own companies, we have our family and stuff. We don't get out and talk that much to other CFOs or HR, whatever you're in, other podcast hosts or different things. But there are so many people that are going through the same thing you're going through. And I find that people are so willing to share, if you
yes.
can just break that bridge down a little bit and start, break that wall down and start building some of those bridges with other people, you're going to learn so much. And that's where I learned so much about benefits was from other people,
Yeah.
and I just try and bring these together and share with other people. But those two things. So
Yeah.
get out,
No,
meet some other people, and then be okay with mistakes. And I think those will serve you well.
yeah, no, absolutely. I'm definitely with you on both of those, Steve. Number one really hits home because I talk to a lot of people about, they want everything to be perfect, and they use that as kind of a crutch or the way to mask insecurities about launching. And so they want to have things perfect and lined up. And I tell you, virtually everything I've ever done has not been perfect, whether it's this podcast, whether it's in banking, whether it's, anything that I've done has always had a little hair on it. And it hasn't been at a perfect stage when I decided to jump out there and do it. But like you, I've always had the notion that I'll be at least 80% of ahead of the people who are still waiting to start.
Exactly.
So it's like anything else. You get out there and you start, and like I started this podcast. My first, in my opinion, my first few episodes were terrible.
No,
I hated the sound of my recorded voice. I didn't like this, I didn't like that, but I was out there, right? And then
you're putting the reps in. You're putting the reps in and doing stuff. That's the only way you're going to get there.
Yep, exactly. Yep, you're very right. So today's guest, Steve Watson, with Trendbreakers. That's trendbreakers.com. MYB, I'd like for you to go there today. As you listen to this podcast or you're watching the video, go there today. It'll be in the show notes. Go there, reach out to Steve. Let him know you heard him right here on the Minding Your Business podcast. Listen, Steve, I know it's hot in that truck. You're there in Arizona, man. Shout outs to your brother. I definitely salute you. You're really neat business. I love the concept of working in groups for that community feel and helping companies on something that's very real and very impactful to many households, man. And so I commend you for that and taking that step. Definitely best wishes to you and safety to you and your family. And hopefully I get a chance to get out there to Arizona. I'd love to meet you, and maybe we can go to a local restaurant there. And
that would be awesome. We could just get out and go to a restaurant, right?
Right, exactly.
just that.
And we'll high five everybody, and
that's right.
Nobody will have a mask on, and we'll just we'll just enjoy a good time, man. But in the meantime, man, again, best wishes to you. Thank you so much for being here on the show. And how do people connect with you? I gave the website, but can people connect with you on social media?
Yeah. So Steve Watson, CPA. So you can find me on LinkedIn. Just look up Steve Watson, CPA. I'm very active on LinkedIn. You can search for Trendbreakers on LinkedIn as well as Facebook if you want to join those two groups. That's where they live there. And trendbreakers.com.
Yeah. Awesome, man. Yeah, listen, Steve, thank you so much again, my friend. This has been great. Learned a lot here, even in a short period of time. And again, best wishes, man. We'll talk again soon for sure.
Awesome. Thanks for having me on.
All right. Thanks, Steve.
Thanks.
All right. Awesome. All right, guys. So, man, that was Steve Watson with Trendbreakers at trendbreakers.com. Thank y'all so much, man. Everybody that is on, you'll see YouTube, Spreaker, Facebook Live, man. Thank y'all so much for joining with me here, man, on episode number 148. Again, we are brought to you by the Binge Podcast Network. Make sure you guys get with me, themybpodcast.com. Email me, Ron at themybpodcast.com. We've got much more content coming your way, much more rich content like you've been hearing that's coming your way, man. And so just excited. Send me any information, send me any thoughts, good, bad, or ugly, there to my email. Would love to hear from as many of you as possible. And let me know what you think when you go to trendbreakers.com and check out Steve and his company there, man. So listen, enjoy the rest of your day. Enjoy the rest of your week. We're now into the month of May. It's already the 5th month of the year in 2020. And 2020 has been a brutal year for many, to say the least, but there's opportunity out there. Will you seize it? That's going to be the question. Champ Ron, the Mind Your Business podcast. You all go be great.